So I have a request for you. I would like you to raise your hand if you've ever worked before. I'd like you to keep your hands up, though, if you remember a time at work that felt really good. So you felt creative or connected or were contributing in ways that felt really meaningful to you. Okay, good. Keep your hand up, though, if you also remember a time at work that was difficult, where you felt overwhelmed, like you didn't belong, or were unsupported. Okay, so most of us had our hands up for all three of those questions. And what that shows is that most of us in this room have a very personal understanding of the real and often very profound ways in which work impacts our mental health. And this experience isn't anecdotal to us. There are scientists and researchers that study this phenomenon all around the world and using various different lenses. And through their work, we've learned a lot. One study of thousands of employees from 10 countries shows that our managers have just as much of an impact on our mental health as our therapists and our doctors. So let that just sink in for a second. Work plays such an important role in our mental health that it's considered what we call a social determinant of health. So what does that mean? It is a factor, a non-medical factor, a social factor that has a profound impact on our health, or has the potential to profoundly impact our health, just as much as dopamine circuits in the brain. For some of us who may be particularly sensitive to the stressors at work, either us or people that we care about who are already managing a mental health condition, the work environment really presents itself as a meaningful opportunity to create an environment that helps us be healthy, helps us connect, find stability, find community, return to work if that's what we want for our lives, recover, and maybe even heal. So given the fact that we know personally and through the data that work has this profound impact on our mental health, and given that we spend 1/3 of our lives, almost 100,000 life hours at work, it seems smart and arguably necessary for us to create environments at work that support us in being healthy and happy and thriving individuals. And these types of work contexts don't have to happen just accidentally. They can be created with intention and based on science. And that's what we do at One Mind at Work. We take the best of science from various disciplines, psychology, sociology, behavioral economics, always keeping people at the center of our work because we know that people are at the heart of workforces and organizations. So you might be asking, what does it mean for us to use science in our work? So just as we saw with the Rising Star awardees, where they are interested in the internal connections and structures that impact our mental health, we at One Mind at Work are interested in the structures and connections in the external work environment that impact our mental health and well-being. And much like our Rising Star awardees, we too employ the scientific method, collecting data in a very structured way to answer important research questions like, in what ways does work impact our mental health? Why are these impacts occurring? How can we bolster the good ones and mitigate the bad ones? And much like the accelerator companies, we think about how do we use these data and the findings of what we're learning and get it to the people who stand to benefit from it. And throughout this entire process, we're constantly asking ourselves, is what we're doing actually working in the ways that we want it to work? So by applying this scientific method, we have learned a lot, much more than I can share with you in the few minutes I have of your time today. But I'll share one thing with you. The one big thing that we've learned is that organizational practices matter. So the way an organization is set up, its policies, its practices, its programs, really impact workforce mental health, the mental health of the people who work there. So things like strategy. Does the organization have a mental health strategy? Are they being thoughtful about the ways in which their policies and programs impact the workforce? Are they providing services and connections to care for those who might need it? Provision of services. But are they also thinking kind of earlier on in terms of protecting mental health of their workforce by creating a psychologically safe environment where people feel like they belong and can show up authentically? Are they promoting mental health through well-being programs, for example? So OneMind has collected these data, and we've created a tool that helps organizations across 10 key areas of organizational practice be able to measure how well they're doing for their workforces in terms of their mental health and well-being. And more importantly, to use these data to make real change for the people who work there and whose lives are impacted by their work every day. Let me give you a real-life example now of the work that we're doing. And this work is a project that really I feel very committed to. And it's in the domain of supporting professionals whose own work also impacts our mental health and well-being. Frontline mental health care professionals. So OneMind at Work has this incredible opportunity to support the leadership of a network of clinics in California who provide life-changing care to young people who are experiencing psychosis, often for the very first time. And the care they provide changes the lives not just of these individuals, but of their families and of all of our communities. Because of the nature of the work, you can imagine they experience some serious mental health and well-being concerns within the workplace. One is burnout, which essentially is the experience of emotional exhaustion, disconnectedness, and a low sense of personal achievement that often is seen when there's an experience of prolonged stress. This isn't okay. We have to support the people that support us. And OneMind at Work is trying to do that by supporting the leadership of this network of clinics. And we're applying this scientific methodology that I just shared with you to this work. We're trying to look through the data that already exists to understand what might be going on. What are the levers that can be pulled to make real change? We're talking to leadership to see through their eyes what might be going on and how can we intervene to do better for the people who provide real and meaningful care for communities and people and families. And 3 days ago, the OneMind at Work team was able to go and meet frontline workers and listen to their voices, listen to their needs, and really understand how we can work with leadership now to create real change for them. I want to bring this all together now with a focus on our vision. We're committed to workplaces that help us be happy and stay happy, workplaces that are intentionally created based on science and with human-centered design principles. And this is key because the work of mental health can't just be happening in laboratories or in clinics or in hospitals. We need to be surrounded by environments that help keep us healthy, including at work. Thank you.